My name is Josephine Wong. I am a professor at the School of Nursing here at Ryerson, and I'm part of the center because of the type of research I do, and as well sometimes I supervise students who are doing graduate studies in areas that tie to immigration, settlement, and other related issues. I have a number of projects that is going on. Many of them are team grants. For instance, one of the study that is coming, to the final year is our weSpeak project, which is a team grant to look at the HIV vulnerabilities of heterosexual Black men. So men who are born here, who are Black, men who are from the Caribbean and African countries as immigrants. And it also look at how do we engage heterosexual Black men and mobilize them so that they will become part of leading HIV prevention and promoting their collective resilience. We have completed our phase 1 and phase 2, and some of the findings we had is it's very clear that their HIV vulnerabilities are actually totally tied to their social vulnerabilities. And we know that racism exists in the Canadian society. So when we look at Black men, we're looking at how their gender identities, their racial identities, and their sexual identities, all those are actually intertwined. And what we found is that the lack of access to equitable education, income, and healthcare actually put them at risk of HIV. So for instance, we found out that participants, so we had connected with over 1,200 participants in 4 cities in Ontario, and participants who have regular access to healthcare facilities actually will have HIV testing more. And so then finding out about, one's HIV status so that you can have early diagnosis, timely treatment, and being able to connect it to care is one of the most important way in HIV responses. So that is really a very important findings. Other findings that we have that is quite critical is that many, especially the young Black men, they are quite resilient. They are resisting a lot of the racial stereotypes about young Black men being, hypersexual, hypermasculines. And so they are coming out with ideas and strategies about how do they actually define their own identities and social identities, not only individually, but also as a group. We have been going out to the communities, connecting with people. So a lot of the places where we connect with heterosexual Black men were actually in barbershops, in some of the local businesses, and that worked out to be quite amazing. And we are now also taking a lot of these findings back to our communities. We are one of the 47 research teams that had been funded by the federal government with the first phase of their research funding. And our project is called Project PROTECH, and it actually had 3 components. The first component is for us to develop a resource hub online, and the resource hub will contain information up to date and links to information that is accessible in traditional and simplified Chinese as well as in English. And also in this hub, we will have information about how to deal with the anxiety or fear or, stress that's related to stigma that a lot of people in the Chinese community has been facing since the coronavirus outbreak had happened. We had heard many incidents of racism from the community. So another part is that we actually will have live chats so that when people had certain type of questions, we'll be able to respond. We'll be training volunteers and supporting volunteers to come on board to be able to provide live chat in Chinese as well as in English. In addition, learning from the SARS epidemic in Toronto at the time, I have worked with a coalition of community leaders, service providers in the Chinese community, and we were able to set up a hotline at that time within a week. And we have volunteers to actually staff the hotline to, give them information in Mandarin, in Cantonese. And that was really critical. Now, the world has changed. We now had the internet, and technology is a lot more advanced than in 2003. So the other thing, I was working at the SARS Control Center at the time, and burned out by service providers was actually quite immense. And also the kind of stress faced by families who are infected and affected and in quarantine also, brought out the issue that people really need psychosocial support. So in this study, the second component, we will be doing online intervention training, and it will target people who are affected. So either they are infected with the coronavirus, or their family members are, and they are very stressed and they're in quarantine, as well as service providers who are, reaching burnout because of stress, as well as community leaders. So the intervention would actually support them to develop psychological flexibility so that they can cope better with the stress. And there will be mindfulness-based activities. There will be things that support them to connect to their values so that they know how they can take action without being kind of distracted by a lot of the hypes or the kind of stress that is happening in their life. Then the third component is actually we'll be doing, ethnographic observation. We'll be doing a lot of field notes taking, and we'll be capturing all the minutes and processes, because it's a project that is tied to a big coalition of support from community organizations. So what we will do is actually capture all the processes so that we can identify what are the best way to actually have the people, resources, and what kind of mechanism do we use to mobilize resources and people so that we can respond better with the coronavirus epidemic, as well as future epidemics that may happen in Canada. So I feel very fortunate in a sense that my research program and my research career actually stems from working closely with communities. Before I joined Ryerson, I was working in public health. And so I have many connections, and I'm already doing programming with communities. And I think the thing that I feel very passionate about and feel very proud of is every research that I work with our teams is based on equity and social justice. And because those are the fundamental principles that we kind of carry out all activities with, then we don't stop at doing a research, find out what's the finding. Every project that we've done so far had led into actions. So action, either we had worked with communities so that we develop and design a program based on the evidence, or that we are actually pursuing engaging communities to change policy so that it could have long-term impact. I think my happiest moment in doing this type of research is many moments of feeling that how grateful I am to have teams of researchers and community partners who share similar kind of beliefs, similar kind of principle, and similar kind of vision. And I felt very inspired by the people who are affected by the different issue, whether it's mental illness, whether it's HIV stigma, whether it's about racism. Their resilience and their passion to do something to have self-determination and community empowerment is what inspired me, and that's what kept me going. I'm actually quite excited about that. I have been actually engaging in community succession, in frontline programming, intervention, as well as research. I've always told my research mentees and my graduate students that research is actually very important, but if we want to engage in research that matters, then before we even get engaged in any kind of project or design, a research, get engaged with the communities. Really find out, hear from the people what affects them and what are the issues that are truly behind those issues, and what kind of dynamics, what kind of social policy, And so always work with the community to define the research questions and define how we proceed with the research question, rather than thinking about a question that is actually removed from the realities of the people who are affected.